So now you picked your surgery, you've picked your surgeon, you got a location, you figured out who's going to take care of you during surgery. So what's next? I really consider this time your cocoon time, right? You're going to come out of the cocoon after surgery or whatever, but we really want to get you to be the healthiest you that you can be. Because surgery, it is a big deal. And I think sometimes we are like, oh, I'm gonna have surgery. It's, la, simple. It's not simple. And there are serious complications that can happen, but the healthier that you are, the less likely those are to happen. And younger people tend to do better as well, because generally younger people are healthier than older people. That's a wide statement there, I recognize. So during this time, and I consider this kind of like a minimum of a month before surgery and a month after surgery, kind of, very minimum, to really focus on being as healthy as you can. But if you have surgery that's coming up in 3 years and you have time to prepare for it, that's awesome. Make the most of that time. If you're smoking or vaping, as you're getting closer to surgery, it's really the time to quit. And we'll talk more about how that impacts surgery recovery and why that's recommended. Work on what you're eating. The word diet, I don't love it because it's used as diet means two things. It means what you eat, and it means trying to lose weight and going on a diet or whatever. I'm not talking about going on a diet. I'm talking about what you eat. What can you get into that's, more healthy? What can you decrease, or what can you stop consuming or decrease consuming that's not as good for you? So if you're having more than one soda a day, how can we get you down closer to one? Those sorts of things. And then if you're not really eating a lot of fruits or vegetables, how can we increase those? And then exercise, moving the body. What's comfortable? What are you able to do? So work on it, improving diet and exercise. And then also take time to work on your mental health and your wellness, your spiritual practices as well. We do know that uncontrolled mental health symptoms, specifically depression and anxiety, actually will lead to longer times for healing from surgery, because your body is trying to heal your mind as well as your body. So if you are depressed and you're not getting treatment for that and taking care of that, then your healing will actually take a longer time. Other things to think about, these are from general pre-op instructions that you see everywhere. Some people recommend taking 2,000 milligrams, which is the same as 2 grams of vitamin C every single day, like a month before surgery and a month after surgery for at least 2 months. I would ask your medical provider and your surgeon before you do this. The theory behind it is some people believe it can help boost your immune system to help you with your healing. It's also something that if you have too much of it, you'll just pee it out. It's a water-soluble vitamin, and so it's okay to have too much of it because you'll pee it out. If you're taking a multivitamin that already has vitamin C in it, it's okay to take this amount in addition to that multivitamin for most people. But again, ask your provider. Do not take any extra vitamin E. Vitamin E is involved in our clotting cascade, which helps to clot our blood. And so if you take extra of that, it may mess up the clotting cascade and may cause you to bleed more. So extra C, not extra E, when you're preparing for surgery. Other thing to think about taking is zinc, specifically to help with scar formation. And what in the world do I mean by that? So for all my biochemistry nerds, you may remember, or some folks, if you went to medical school or PA or NP school to be a health professional, that zinc is actually one of the bonds that's required to make scar material or for wounds. And so zinc, like iron, is a metal in the body. People know that when they bleed a lot, they lose iron, they become anemic. That's something you might have heard of before. So it's possible to have low stores of iron. Same thing with zinc. Because after surgery, we're making way more scars than we usually do on a daily basis, we may run low on our stores of zinc. So a month before surgery and a month after surgery, 2 months of taking daily zinc can help with scar formation. Again, run all of this by your provider before you start. I think something that's super important that we rarely talk about is taking some time to reflect on what makes a healing environment for you. And whatever you come up with, seeing how you can replicate that in the places that you're going to be staying to heal. Whether that's if you're doing inpatient surgery, that means you have to stay in the hospital for a while. So the hospital room, and then the place you go after the hospital, and then the place you go for home, wherever you're going to go. Think about what are the things that when you were young, when you were sick, what made you feel better? Was it something that your parent cooked you? Was it a particular song? Was there were smells, incense, religious or cultural practices, prayers? Did you have a curandera? Like what exactly, felt healing for you, and how can you incorporate those aspects in your recovery process? This is an important thing to talk about with your caregiver so that they can help you to get that set up. And also think about what does not make a good healing environment for you. So if there's somebody who calls you every day that really makes you upset, maybe not talking to them for a while during this process is important. So just as important as what does make a healing environment and adding those things is removing those things which do not contribute to your healing, which increase your stress. We want to have as low stress as possible so that you can heal as best as possible. As my mom is a doctor, and when I was going through these things too, she was like, you got one chance to heal, you got one chance. So make sure that you do anything that you can to make it a good experience. The surgeons will also tell you not to take aspirin, ibuprofen, or things that they call NSAIDs, non-steroidal anti-inflammatory drugs. These are also include Advil, Motrin, Excedrin. I've never heard of Anastin or Buffer Datril, but some people take these things. So make sure that you're not taking anything like that immediately before surgery and after surgery. Your surgeon should give you a long guideline and list of things, and it should tell you how many days before surgery not to take these things. I always just say it's safe to say it for everything a month before to a month after, because usually it's not that much that they require, but do whatever your surgeon's information says. Now, why is it? Why can't I take an Advil when I'm preparing for surgery? Well, these particular medicines, NSAIDs, including Advil, mess with our clotting cascade. So we don't clot as well, and we'll be more likely to bleed. And they don't want us to bleed any more than we have to during and after surgery. Tylenol is okay if you need it. So if you have a headache the week before surgery, instead of taking an Advil, take a Tylenol instead. But that's going to depend on how your liver health is. So make sure that's, if you're generally a healthy person, don't have any diagnoses, not a problem. But, if you have some health concerns, then make sure you check with your doctor on that. You'll also be given prescription pain medications to take after surgery. And so it's important that whoever is going to be administering your medications, your caregiver, feels comfortable with handling these and giving them to you, because they'll need to be in charge of that, not you, during those couple of days after surgery. If you're staying in the hospital, then a nurse may be administering those for you. So that's an easy thing to do. But just know that most prescription pain medications have a bunch of Tylenol in them. So if you take them plus extra Tylenol, make sure you don't do any more than your surgeon would recommend, because it is possible to overdose on Tylenol, and that is very scary. All right, now let's talk more about smoking. Why do they say don't smoke? We're talking about tobacco and nicotine products here, okay? Do not smoke tobacco, nicotine products before surgery, and really any substance. We'll get to that. Why is this? Well, I'll read it to you. Smoking can cause poor wound healing and may result in issues with scarring, including a bigger risk of your grafts not adhering or sticking to your body and falling off, AKA your nipples. So for folks who are having double mastectomy with nipples, what I find is that of those people who had a nipple not stick and fall off, 9 out of 10 of them were smoking at the time. And that includes any kind of grafts that you get, not healing as well or not adhering, aka sticking as well. Why is that? Well, what nicotine does is it takes our blood vessels, which usually are nice and open, and it constricts them. So it's the metaphor or whatnot is if you have like a 6-lane traffic or whatnot, and let's say all the different trucks that go down all the lanes have to bring oxygen, immune cells, and nutrients to the wound that's trying to recover. But if you smoke, then you reduce that vessel size to only 2 lanes. So you're not getting near as much of what your body is trying to give you to heal itself. And so big issue with nicotine, and why most surgeons will test to see if you have any in your system and will not operate on you if you have any nicotine or tobacco in your system. It causes more complications, and they don't want complications. They want you to have a good experience. Now let's talk about weed as well. It's legal in many different places, and people, regardless if it's legal or not, commonly use this substance. So smoking any substance, whether it's nicotine, tobacco, or weed, can also increase coughing because of what we're doing to our lungs. Coughing can interfere with healing. What do I mean by that? So when we cough, a lot of times we will tighten our core, and our body will flinch and then relax multiple times in a row. So when the body is trying to relax and make scars in place, if we cough and we have kind of our nice scars looking like this sticking together, when we cough, they can go like this. And that can break apart a lot of the bonds of the scars that are trying to form. And then they have to restart. So it's really important to get your coughing under control. If you have asthma, if you have all these other things, make sure that you're, getting everything appropriately controlled. And where you stay. So if you're staying in a place that has a lot of allergens or somebody smokes there, it'll be important to try to find either a different place or try to minimize your exposure to things that make you cough or not heal as well. Some of my patients say, you know what, I literally have to have weed every day. I just have to, and I'm not able to stop weed. Well, what I say is this, if that's your case, maybe you have medical marijuana, or maybe it's just, something that you're addicted to, or something that is just part of your life, you really need to move, if you can't quit, then I would at least move to edibles. And that is not an easy thing to do. It requires practice. It requires making sure that you have a safe site to get those from. And also, you hear plenty of stories, oh, I had that and I was sleeping for 3 days. So it's important that you practice before surgery recovery to figure out what dose and what you take, if that makes sense. I would completely avoid using any substance when you're taking the pain medications, the prescription pain medications after surgery. Just before surgery, many surgeons will send you home with some sort of wash, very much like an antibacterial wash for your face or chest or genitals. It's usually called betadine or hibiclins. These are dark orange or dark red type products. You really want to wash the area thoroughly. It should give you instructions on what to do, but make sure you don't just wash yourself with this and then take a shower, because if you take a shower afterwards, you'll wash it all off of you. So I would just make sure that you, no matter what, you just follow the instructions on the washing, product that they give you. And usually they'll have you do this every day for a whole week before surgery. But if you're a person with skin allergies or very sensitive skin, before you just kind of pour it all over yourself, apply a small amount of the product to a small area of your skin and see if your skin has a reaction or not. Much easier to deal with a small skin reaction than you put it all over your chest or all over your genital area and you're totally, broken out in some way. Not great. If you do have a reaction, these are very, very rare. I do not expect these to happen, but some people are just sensitive. Contact your surgeon's office, let them know, and ask for another product. And make sure that you let your regular doctor know so that they can put it on your allergy list. If you have companion animals or pets or, whatever word you use for that, where you're going to be recovering, you should really make a plan to make sure that somebody's taking care of them, not you. You're recovering from surgery. And if you're the caregiver, you're taking care of the patient. So make sure there's some sort of a plan for care of those animals, and also to make sure they're not shedding hair or feathers or whatever it is on the surgical site, and make sure they're not laying on your surgical site when you recover. A lot of times animals, dogs and cats specifically, really want to be close to us, especially when we're recovering from pain or we're sick. So it's really important to have some boundaries with that. But still, many of them feel very healing, and it's part of the healing environment to figure out, well, maybe they can sleep on my feet, whatever that is. So figuring that out is important as you're preparing for surgery. Next is ask your surgeon if they want you to stop hormone therapy before surgery. So this is only applicable if you're a person that's on hormone therapy. Research really does not support the practice of stopping hormones before surgery. However, some surgeons still want their patients to stop hormone therapy before surgery. I always say do what your surgeon asks, but make sure you find out when you can restart. Is it when you wake up from surgery, you can have your next dose? Is it a week later? Make sure you're very clear with when they want you to start and when or to stop and when they want you to restart your hormones. Stopping hormones is not like this easy thing. You know, when people's hormones are out of whack, none of us are the best us that we can be. So it's ideal if they don't have you stop them, but if they do, you really need to follow that, because many folks will test you to see if you have lower levels or not. All right, supplies. There's lots and lots of websites online that talk about what supplies you need for surgery. So this is nowhere near comprehensive, but it's at least a list. Your prescriptions that the surgeon will prescribe you should be filled before surgery if this is outpatient and you're going home after surgery. So that way your caregiver doesn't have to go get them when they're trying to transport you to your recovery location. For example, case in point, somebody I know had a friend pick them up from surgery and go directly to the place where their prescription was. And there was an issue because the prescription is a controlled substance, and they were also out of state. And so it took forever for that person to get that prescription. By the time they got back in the car, the patient who had had surgery was in such pain. The pain was so out of control that they had to go back to the hospital. That's stressful. We don't need to be messing with all of that. So if they give you the prescription beforehand, make sure, you know, if you're the caregiver, you already got all those prescriptions when you're picking the patient up. Because having to stop somewhere else and having issues with getting the medications can cause undue stress. Have some Tylenol when it's time to get off of the pain medicines, prescription pain medicines, and move to Tylenol. Have that with you. General things that might be useful: hydrogen peroxide, Q-tips, little cups for cleaning incisions, gauze, supplies to cover the incisions. Incision means where they cut. Vaseline, antibiotic ointment for wound care, baby wipes for cleaning off before you're allowed to shower, especially if you live somewhere where it's really hot, and especially if you're on testosterone, you can be pretty stinky. And if they're saying you can't shower for X number of days or hours, having somebody else to wipe off your neck and, you know, different places will be really important. Saran wrap for when you can have a shower, but you need to keep areas dry. If you're a person who's had any sort of breast or chest surgery, kind of a saran wrap trick that has been super helpful is wrap around like twice and then over the shoulder one time, over the other shoulder, so you have sort of an X situation, and then repeat that whole thing again. That typically will cover this whole area to keep you dry in the shower. But make sure you don't get the microwavable kind, because those have holes in them. So make sure you get the regular saran wrap, and also not the colored kind, because you don't want to have a bunch of colors on you. So plain saran wrap. A removable shower head is really key. If you're staying at a hotel, I would say please reserve the accessible room. That'll have a much better shower setup than general rooms. If you, for whatever reason, can't get a removable shower head, a bucket and a sponge sit on the side, you know, that sort of thing is generally what is best to do. Make sure you have a thermometer with you, because infection is a possibility after surgery and is an emergency. And so make sure if you're the caregiver and the person feels warm, you know, make sure to see if they have a fever. If a surgeon says to use ice packs, you're going to want to have those. Some sort of a whiteboard or paper to keep track of all the meds. If there's a drain, an output, and catheter or dilation times, make sure you have somewhere to centrally keep track of this. And really the caregiver is going to be the main person to help with this during recovery. If they want you to sleep elevated, make sure you have pillows to do that. If you've had certain face or breast or chest surgeries where you're not able to either open the mouth or move the arms in this particular way, have straws for drinking. If you need to dilate, so if you're getting a vagina, then make sure you bring lubrication for that. Ask your surgeon what kind of lubrication they recommend. If you're staying in a hotel room, or not in a hotel, sorry, in the hospital, get an extra long phone charger, because you have no idea where the plug is going to be relative to your phone. These are just some of the basics. There's plenty more, but make sure that you come prepared with getting the supplies that you need.